When evaluating a patient with a right iliac fossa lump, precision is key for an accurate diagnosis. One simple question can immediately narrow your differential diagnosis. Did the pain come first, or did the lump? If pain precedes the lump, you are likely looking at an appendicular mass or an appendicular abscess. However, if the lump appeared before any pain, consider carcinoma caecum, ileocecal tuberculosis, or Crohn's disease. Next, dive into constitutional symptoms. Ask specifically about fever, significant weight loss, and loss of appetite. Always probe for changes in bowel habits, bleeding per rectum, or any signs of intestinal obstruction. Progressive constipation, especially in older patients, strongly suggests carcinoma of the caecum. Alternating diarrhea and constipation is a classic sign often associated with ileocecal tuberculosis. Chronic diarrhea with abdominal pain frequently points toward Crohn's disease as the culprit. Don't forget other systems. Ask about urinary symptoms to rule out renal or ureteric pathologies. In women, a thorough menstrual history is vital to exclude ovarian cysts or pelvic inflammatory disease. Moving to the physical examination, we must be systematic. Remember the 8 pillars of assessing a mass. You must assess the site, size, and shape, and carefully feel for the consistency of the lump. Note any tenderness, define the margins, check for mobility, and determine its relation to surrounding structures. A tender, ill-defined mass is highly suggestive of appendicular pathology, like an abscess or mass. A hard, irregular, and fixed mass is a classic red flag for carcinoma of the caecum. A firm mass accompanied by night sweats and weight loss strongly suggests ileocecal tuberculosis. Always perform the Psoas test to check for irritation of the psoas muscle by a retrocaecal appendix. And never forget the mandatory rectal examination to check for pelvic deposits or primary tumors. For investigations, start with an ultrasound. It's the best initial screen for any abdominal mass. The CT scan remains the gold standard for characterizing the mass and planning further management. Finally, a colonoscopy with biopsy is essential for a definitive histological diagnosis in suspected malignancy. So remember, pain first usually means appendix. It's an inflammatory progression. But if the lump comes first, think cancer, tuberculosis, or Crohn's disease. Think structural and chronic. Master these clinical pearls and you'll be well on your way to surgical excellence. See you in the next lecture.